Do you suffer from headaches and or facial pain or temporomandibular joint pain? One key muscle I really want to draw your attention to is the sternocleidomastoid. We call it the SCM. It's a pretty prominent neck muscle. Obviously, we have one on each side of our neck. And one thing I want to show in these images is when we develop trigger points or possibly just constricted or tight tissues in the two different divisions of the sternocleidomastoid, you can see from that image that the sternal portion of this SCM can cause and refer pain to the base of your skull, your occiput. So some people who might complain of headaches that are in the back of their head, or they might complain of headaches and or symptoms around their entire eye area or the side of their cheek or occasionally into their chin area. But I would say the more typical symptoms I see are the base of your skull, the back of your head, and around your eye. In addition, a lot of clinicians, I think, tend to forget that there is the second division of the SCM. We call it the clavicular portion. And that clavicular portion, once again, you can see can cause symptoms even into the ear. So if you're having ear-related symptoms, the back of your head, or a frontal headache or along your forehead. So this is a really important and key muscle to at least make sure that it has been screened. And the other thing I can tell you from a clinical perspective is when the clinician, or even you try to do this on yourself and you're palpating this muscle, often you have to hold your pressure for at least 10 or 20 seconds to see if the referral pattern will be recreated, or meaning, can you recreate the pain and symptoms that are familiar to you? And then in the next video, we're going to show you how one simple way to at least start to stretch this SCM muscle at home. So one way to identify where your SCM is by its function, right? So our left SCM, right, two of its primary functions is to side bend our head towards the side, same side, but then rotate away. That's how this left SCM would function. So if when that muscle is shortening with a side bending to the left and a rotation to the right, if we want to lengthen it, we have to do just the opposite. So to stretch our left SCM, we actually want to side bend our head to the right and then look upward off to the left. And that already alone for some of you may create a very gentle, I always say less is more. So maybe just by very gently tipping your right ear towards your right shoulder, rotating your head up and back would allow you the opportunity to put a stretch on your sternocleidomastoid on the left. But another way to anchor it a little bit better is just very simply take your hand and apply it just by your collarbone. So that's going to be your landmark, is your collarbone here. I'm just applying a little pressure into the skin and then a little bit downward pressure. And I'm going to just very gently tip my head to the right and then look upward. And I literally can feel a very nice stretch from the insertion of that muscle all the way up to the origin at the base of the skull bone, your occiput. And I usually encourage people to hold it for 20, 30 seconds, even up to a minute. Very gentle, 3 out of 10 stretch, more is not better. So a good minute or so if you can tolerate, twice in a row, maybe once or twice a day. But this is something so simple that you can do to both sides while you're at your desk, after looking at your computer for a long time, when you're at home, or even when you're in your car at a stoplight. If you got a few seconds just to do that stretch. So again, very effective stretch. Possibly that's going to help alleviate your headaches and your persistent TMJ, or be part of the solution.